In this podcast, I'm going to talk about another issue, which the patient might come and say, Doctor, I would like your help. So basically, you introduce yourself, double check the patient name, date of birth, and ask the patient, how can I help you today? So the patient will tell you, Doctor, I've been a smoker, I'm a heavy smoker, and I would like to quit this habit, so I would like to have some help. Or basically, you are seeing a patient who have chronic obstructive airway disease or chronic bronchitis, and you advise the patient if they have any thought about stopping smoking and how to guide them through the clinic, which could help them with that. So basically, either the ways you will talk them through how can we help about smoking stoppage. So basically, you will tell them, can you tell me, firstly, what's the reason for this? Do you have any medical issue that made you think about this in order to know that the patient is adamant to stop this and he's willing to do the kind effort to stop it? Because it's hard for certain patients and they might relapse later on. So you will tell them about the different choices, different options what's available. Say, for instance, there's something called nicotine replacement therapy, which is given to those patients who are addicted to nicotine or they're a heavy smoker. So this will help them gently because it provides low level of nicotine without the tar and carbon monoxide, a poisonous chemical. So it will help reduce the unpleasant withdrawal side effects like the bad moods and craving, which happen sometimes when patients stop all of a sudden smoking. Also, you'll tell them that there is other modality, for instance, which is available on prescription from the doctor or from the GP, like the skin patch, like chewing gum, certain tablet or oral strips, lozenges, and certain sprays can be applied as well, which all of them work the same idea, is by slow release of nicotine, and it will help gently the time to help about the craving for smoking. So that is about this way, and also you need to double check if the woman she's not, for instance, pregnant, or when did she have her last menstrual period, or she's not breastfeeding as well. For this one, basically, you will emphasize that there is certain side effect that you need to bring to the patient attention in order for them not to stop the medication and say, oh, I can't continue with this one. For instance, they might have, like for the spray, they might have certain irritation if it's a nasal or a mouth spray. If it's a batch, it might cause local irritation. It might, generally speaking, cause indigestion or gastric upset. It might cause also dizziness, headache, and certain patients that might have difficult sleeping, might have vivid dreams. So you need just to tell the patient in order for them to know this, and if it causes any trouble for them, they need to come back to the GP, and the GP might or come back to the doctor in order for them to look for another option that they can try if the first option did not work. Also, there is another medication which is also been advised before. It's varenicline, which is, the brand name is Cambex. It has been found, it was advised before, but it has been found it has some precaution in purity. So it has been withdrawn, and it's not used anymore. But it was shown that to reduce the craving as well and block certain receptor for the smoking. There is another one which is called Bibropon. It's another medicine can be used as well, which help the patient to quit smoking. it's not well known how it works in the addictive behavior, but it works. So it's basically tablet to be taken each day to help about quit the smoking and stop the craving as well. It's not mandatory, of course, or advisory for pregnant women or adult under 18 years old, or a patient who had history, for instance, of epilepsy, bipolar, or eating disorder. So I need to inquire about all of that, and you need to bring to the patient attention as well for any expected side effect like dizziness as well. It might cause sickness, headache, as well, insomnia, sleeping problem, dry mouth. So you need to tell them that you need to drink too much water, try to keep hydrated, and also it might cause constipation as well. So that's thing that you need to bring to the patient attention in order for them to not stop the drug by themselves. Also, the other thing, it's the e-cigarette or the vaping, which is common nowadays. You see it anywhere and everywhere. It's meant to be like electronic device to deliver nicotine in a fiber with different flavor. It's not very safe. I wrote a paper about it. You can Google it under my name, and you can read about it. There's a lot of controversy. About vaping, and now they try to ban it, especially in teenage and younger age, because it's common seeing teenage young people using this sort of smoking. And as I say, it's not completely free. However, it's just a way to help with the efforts to stop smoking. So I hope by that I covered most of the points about smoking and how to stop it. Thank you.